Hi, I'm Dr. Julie Steinauer. Well, the best topic that we can ever talk about is Syntonics. Everybody loves to hear about light therapy, so I thought I'd do another video discussing a little bit more in depth about why Syntonics is so great for traumatic brain injury patients. So let's dig in a little bit. Now, I typically tend to also show you what these filters kind of look like. Just so you can kind of see, there's some different colors here. And lots of different colors of the rainbow kind of visible light spectrum. Each one of these colors does something differently. But why are they so successful for treating traumatic brain injury? Well, a couple of reasons. One is that Syntonics and light therapy will establish or re-establish a proper blood flow throughout the brain. So if you've had a stroke and a person has said, like, this area of the brain has lost some ability to process information because the stroke stopped the blood flow here, then we can, the Syntonics filters will actually kind of increase some blood flow back to that area again. If there's no blood flow, usually you're not going to have like neuron connectivity or connections that are also happening through that area of tissue. So it's kind of like the nerve fibers maybe are not getting any information the same as what they were before because there's no blood flow there. The tissue is really considered almost not viable anymore. But if we increase blood flow there, then we can also get neuroconnectivity or neurons to be kind of sparking in that area again. Now, the importance of that is depending upon what happened in the injury, whether it's stroke or just another type of traumatic brain injury, it could affect vision, where some people will lose maybe even an area, a side of their vision. Maybe they'll gain kind of get like a tunnel vision. It may affect motor control even throughout their body, depending on what area of the brain is affected. So if we can increase blood flow and neuron connections in that area again, then we can maybe turn some of that tissue back on to functioning better and regain some of our ability that was lost because of the area of the brain that was affected. So that's how it works. That's why it's so successful, because we're kind of really directly sending blood flow back there again, neuron activity or like brain connections happening in that area again. And then we're using other procedures with vision therapy that's more mechanically training your brain to process vision again. So vision restoration, if someone's lost again, maybe some visual field or lost some visual field or lost some visual field, then we're able to work on trying to regain that. Maybe again, like we talk about, like a tunnel vision has just occurred and it's not necessarily a specific area of visual field loss. Maybe even sometimes it's up here or down here. Visual field loss can occur in a lot of different areas. But we are really working to establish blood flow, establish neuroconnectivity in the area again. Also, we want to establish a kind of a more well-rounded functional visual field, or gain back visual field and restore it. And the other thing is that we want to balance out the nervous system, which is known as the autonomic nervous system. It's two components within the brain that control basically all of the functions within our body. And so we want to balance those things, and that's what Syntonics helps to do. So that's a lot. But that's why it's so powerful, because even if I have someone who comes in and, their main concern is an eye is not functioning as well, maybe it's turning out or in or something after they've had a stroke or injury. And maybe they also have an issue with motor control. So maybe they've got a problem with their hand and arm or their leg. Then with using Syntonics, it not only turns on the connections within the brain, but it sends signals to the muscles throughout the whole body. And so if I have someone who's maybe lost a little bit of sensation or ability on, say, the right side of their body, and then we would have them wearing the goggles and squeezing a ball like this in the hand on the right side, or whatever they can do, tapping the foot and the leg. As I tap on the floor with my boot. All right, so tapping or moving or doing something that's increasing blood flow, causing neuron connections to happen through those muscles and sending better signals. And maybe we can get some of that weakness to not be so weak anymore. Does it work like magic and make everything go away? No, we're not saying that at all, but we do work in conjunction with other therapy individuals who help us out, and we help them, like occupational therapists and physical therapists, and they might be working on things improving strength and motor control, and this is another component that's electrically stimulating that area of the body. Now, our number one goal isn't that. Our number one goal is to work on vision. That's just a side benefit. And if we know it's a side benefit, then we're going to use it to our advantage to help our patients so that they can regain as much, functional life back as what is possible. Now, if this resonates with you, or if you know it would resonate with someone else because they've had traumatic brain injury, obviously pass on this video and share it. Like the video, follow us on our YouTube channel, so subscribe to stuff, but contact us. And so if you're local, call us at 618-288-1489. If you're not local and maybe you're in Texas and you're thinking, this is awesome, but I wish you were in Texas, well, you can still contact us for our out-of-state or out-of-country patients. And we do have tons of patients who are out of state and out of country. Then what we would encourage you to do is you can go to our website and fill out the questionnaire at visionforlifeworks.com. That questionnaire sends over to us, so we'll get information to you about how we can work with you. You can also skip that. You now have the ability to just book an online consultation with me if you want to talk directly to me. And realize that we have so many patients contacting us every month. We have upwards of 200, 300 people contacting us each month. And so we can't spend time with everyone. There's just not enough hours in the day. So if you'd like an online consultation with me, you can book that straight from our website also. All right. Thanks for tuning in. I hope this was valuable information, and we look forward to making you or someone you know who's had traumatic brain injury have successful recovery of some of their vision. Thank you.